11. Medical Education 1A. Medical Education in the UK. Medical education in the UK covers undergraduate education for 5 years in medical school. The sections of the university responsible for medical education. A 2-year foundation program which provides training for new doctors after graduations through a series of placements in different specialties. See Unit 12. Postgraduate training which doctors take to become GPs or consultants. Senior specialists often delivered through college for different specialties, for example, the Royal College of Physicians. Continuing professional development in the form of courses and seminaries, which doctors undertake throughout their working lives to keep up to date. Extras for an undergraduate prospectus. The MBCHB, Bachelor of Medicine, Bachelor of Surgery, is a 5-year undergraduate medical degree course. Most of your learning takes place in a small group. The main components are core GS 123, an integrated program of clinical and scientific topics, mainly presented through problem-based learning (PBL), where you work with others on a series of case problems. Student select modules allow you to choose from a menu of subjects such as sport medicine or even study a language as preparation for overseas selected. A hospital attachment of your own choice between years 4 and 5. Vocational study and clinical skill. This campaign prepares you for the clinical skill required for contact with patients from year 1 of your course, through periods of practical training when you are attachment to a hospital department of general practice. Clinical attachment years 4 and 5. A series of 4 with clinical attachment in medicine surgery, psychological medicine, child health, obstetrician and gynecology, and general practice. A student's view. Ellen, a medical student, described her course. I'm just finishing my years of medicine. What I like about this course is that you're involved with patients from the very beginning. Even in our first year, we spend time in hospital. Much of the course is PBL. We have 2 hour sections a week where we work in groups of 8 to 10 solving clinical problems. We decide together how to tackle the problem, look up books and online sources, make notes, and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students have lectures with the whole class taking notes for lectures from 9 to 5, but now it's mainly group work, although we do have some lectures and seminary, and we will work in a small group we are tutor. I like all of this, even the dissections. We get to cut of cadavers from the second month of the course. Exercise in that unit 11. Match this activity to the state of the medical education in UK given a year positive. Dissecting cadavers, graduated. Keeping a log of surgical procedures observed and performed, postgraduate. Working for 4 months in accident and emergency to experience this specialty foundation program. Taking a 4-week attachment in obstetrics and gynecology on graduate. Taking an online course of recent developments in cardiovascular disease, continuing professional development. Complete exercise 2. Complete the sentences. Look at B and C are positive to happy. Just before the final year, students have the chance to take an elective in a hospital of their choice anywhere in the world. Problem-based learning constructs with the approach where each subject is taught separately. These days, lectures are often interactive, with regular opportunities for the students to ask questions. In clinician attachment, students learn how to treat and manage patients. Students select modules can be a topic from outside medicine, such as foreign language. These sections of cadaver is an important part of the anatomy component. The medical school of the University of Edinburgh is one of the oldest in the UK. She is a consultant of the Royal, one of the leading pediatrician heart specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have a seminar each week where we discuss topics in a small group with our lecturers. Exercise 3. Much of this activity through one of the components of the graduate course described in B and C opposite. Julia spent 6 weeks working in a small hospital in the Himalayas, overseas elect. A group of students discussed together the possible reason for abdominal pain after meals is an obsessed 44 years old male. Problem-based learning PMB. A small group of students trace the pulmonary artery in the cadaver dissection. Others spend a month working in the pediatrician ward of the local hospital, clinician attachment, and learns how to take blood from elderly patients, clinician skill. Huma chose to study travel medicine in his first year. Students selecting module. Unidad 11. Educación médica 1. Educación médica en el Reino Unido. La educación médica en el Reino Unido cubre educación de pregrado, 4 o 5 años en la Facultad de Medicina, la selección de una universidad responsable de la educación médica. Un programa básico de 2 años que brinda capacitación para nuevos médicos después de graduarse a través de una serie de prácticas en diferentes especialidades. Unidad 12. La formación de posgrado que toman los médicos para convertirse en médicos generales, consultores, especialistas superiores, a menudo se imparten a través del colegio para diferentes especialidades, por ejemplo, el Royal College de Médicos o Physician. El desarrollo profesional continúa en forma de cursos y seminarios que los médicos realizan a lo largo de su vida laboral para mantenerse actualizados. Extracto de un prospecto de pregrado. Licenciatura en Medicina y Licenciatura en Cirugía es un curso de pregrado en Medicina de 5 años. La mayor parte de su aprendizaje se lleva a cabo en 2 grupos pequeños. Los componentes principales son básico, año 1 a 3, un programa de pregrado de temas clínicos y científicos, presentados principalmente a través del aprendizaje basado en problemas requeridos, PBL, donde trabajan con otros en una serie de problemas de casos. Módulo seleccionado por estudiantes, los módulos seleccionados por el estudiante, por sus siglas en inglés SSM, le permiten elegir entre un menú de materias como medicina deportiva o incluso estudiar un idioma como preparación por una materia optativa en el extranjero, un vínculo hospitalario de su selección entre los años 4 y 5. Estudios vocacionales y habilidades clínicas. Este componente lo prepara para las habilidades clínicas de su curso a través de periodos de capacitación, práctica en los que están adscritos en un departamento de hospital o práctica general, adjunto clínico año 4 y 5, serie de adjuntos clínicos de 4 semanas en medicina, cirugía, medicina psicológica, salud infantil, obstetricia y ginecología y medicina general. El punto de vista de un estudiante. Ellen es una estudiante de medicina y describe su curso. Estoy terminando mi primer año de medicina. Lo que me gusta de este curso es que te involucras con los pacientes desde el principio. Incluso en nuestro primer año pasamos tiempo en el hospital, la gran parte del curso. Tenemos 2 secciones de 2 horas por semana donde trabajamos en grupos de 8 a 10 resolviendo problemas clínicos. Decidimos juntos cómo abordar el problema, buscamos libros y fuentes en línea, tomamos notas y discutimos el caso juntos. Es una gran manera de aprender y conocer a los otros estudiantes. En el pasado, los estudiantes de medicina tenían conferencias con toda la clase, tomando nota de los profesores de 9 a 5. pero ahora es principalmente trabajo en grupo, aunque tenemos algunas conferencias y seminarios donde trabajamos en grupos pequeños con un tutor. Me gusta todo, incluso la disección, y llegamos a descuartizar cadáveres a partir del segundo mes de curso.